This is a place where we gather, where we talk, where we exchange ideas, where we disagree, where we create new knowledge, a whole ecosystem around health, healthcare and humanitarian action.
Two-thirds of humanity has no access to radiology. It's a major health problem. The technology on one side is not well adapted, and the business model or the way to deploy technology are not adapted. At EPFL, we have the approach to work on business model, to really bring key actor, stakeholder, that will influence our technology and also the way we're going to deploy it on the field. The focus is really to have a sustainable impact.
Because health is a fundamental right. Because medical progress has been extraordinary for several decades, because these advances have not been sufficiently shared, the 6th edition of the Geneva Health Forum allowed us to search together for fairer, innovative solutions for the future. The Geneva Health Forum focuses on innovations that are accessible to the greatest number of users and that respect our planet.
The Geneva Health Forum is not only a 3-day conference. What we want is to promote an affordable and sustainable innovation for healthcare. It's not only the academic world who met, it's also all these organizations we have in Geneva, and only in Geneva, the headquarters of many international health organizations, NGOs, public-private partnerships and private enterprise. Together, all together, how we can find solutions, some options to change the things, how we can make this innovation accessible to the largest number of people.
This is not just about talking, this is about walking the talk, making things happen. The HUG is the main partner. It's actually the force that actually created this forum 10 years ago. This is part of the DNA of this hospital to worry about global health.
Lorsque vous détruisez la femme, vous détruisez également la famille qui est la cellule de la nation. Et ce qu'on peut observer aujourd'hui, c'est que lorsque les femmes sont violées en public, elles sont violées par plusieurs personnes à la fois. Non seulement on détruit leur capacité de procréer, mais également il y a une telle humiliation que la famille se disloque.
It is thanks to innovation in Geneva that we are able to share major medical breakthroughs. Here, at the heart of this ephemeral hospital, inventions have emerged from all around the world, from the north and the south, designed by and for caregivers and their patients.
Innovation that will really pay off on the ground, where ingenuity and simplicity are combined to make things that are economically accessible to everybody on the planet, no matter where they will be. This forum is succeeding in that goal.
In order for these ideas to be implemented on the ground and be tailored to the needs and constraints, particularly among the most vulnerable populations, the parties involved must have the opportunity to speak, and we must allow the creative, bold and entrepreneurial spirit of those who wish to participate in these exchanges to flourish.
For Tadesum to participate to such an international conference gives lots of outcomes, and it's very interesting for us to share our experience on the field with such a product that we have in Burkina Faso, and also to meet other actors in the humanitarian field and share the challenges that we can meet on the field.
Innovation can be non-technologic. For example, to diagnose the cause of fever, for example, in low-income countries. We need a really innovative approach to consider, the different diseases that are causing fever in low-income countries.
The Geneva Health Forum offers that meeting place, hosted by the World Health Summit in Geneva in a spirit of openness, dialogue, and what we would call co-opetition. By 2018, global healthcare will benefit from the momentum of the entire Health Valley and the support of the Geneva University Hospital, the undisputed capital for healthcare, peace, and human rights.
Innovation, of course, has many aspects. But if you talk about health, you also have to develop products. I mean, without drugs, without medical technology, many sick people cannot be treated. So how can these technologies be used for the improvement of health in populations where major hospitals, for example, are not available? So innovation is a big spectrum of different new ideas brought into practice.
So innovation in terms of the detection of falsified medicines can be very useful for the detections of falsified drugs. The pharmaceutical industry is actually investing in specific barcodes to detect if a product is a good one or a bad one.
In the humanitarian field, particularly for actors who are working in conflict-affected areas, it's becoming more and more difficult to reach the populations most at need. So for us, innovative solutions in health are critical to make our work more efficient, to be able to deliver services faster. So we are really looking forward to collaborations like the one here, taking place at the Geneva Health Forum, to develop new solutions or to adapt solutions that are already working in developed contexts and that could be really deployed in very low resource settings.
Meetings like this are important to bring people together from different areas of the world, bring their innovative ideas for the common goal, and that is improving global health.
In 10 years, the Geneva Health Forum has become a major dialogue and place of exchange through partnerships and close collaborations with EPFL, CHUV, the STPH, the SSPH, the STC, the FOPH, the FDFA, and the Swiss Mission.